Hi friends, today we are going to discuss about a new topic, homeostasis, one of the first and familiar topic in physiology. And coming to the topic, the word homeostasis was introduced by one physiologist by the name of Walter Kennan in the year 1871, 1945. This can be our neat PG bit. The word homeostasis was coined by Mr. Walter Kennan. Okay, so what is homeostasis? Is it necessary to know about homeostasis, and what made him to understand discover this homeostasis? So coming to the point, is it he coined this term to describe the maintenance of nearly constant conditions in the internal environment. Okay, so to make it simple, see, we our body is designed and we have a number of systems. For example, we have cardiovascular system, respiratory system, neurological system, and excretory system. Okay, these are the major systems we are having, and these all the systems are functioning in coordination, giving respect to each other. Suppose if one of the system is overreacting, suppose you think a patient has got a Parkinson disease. So, do anybody know Parkinson? Parkinson means patient will get tremors as a main symptom. Okay, so at the time his hand will be with the tremors. Whenever he wants to do some work, he'll get extreme tremors and he cannot hold. So at that time what will happen? The neurological activity is over dominating the normal activity. So here there is no peace in the body. I mean, not peace, there is no constant environment in the body. One of the system is overreacting, another systems are not able to compensate this one. So this is one of the example of homeostasis. And see, essentially all organs and tissues of the body perform functions that help maintain these relatively constant conditions. For example, the lungs provide oxygen to the extracellular fluid to replenish the oxygen used by the cells. See, what is the function of the lungs? They take air, atmospheric air, and produce the oxygen which is used by our body from the extracellular fluid. Okay, and it is supplied via blood to all the body parts to be utilized. Okay, once the oxygen is used up, again what our lungs will do, it will inhale continuously and prepare oxygen, and it will keep on supplying the oxygen to the blood to be carried out for the functioning of the various parts of the body. So this is an homeostasis. So what is doing, whenever there is a depletion of the oxygen, lungs are replacing the oxygen by inhaling. Okay, that is a function of the lungs. So what is lungs doing? They are maintaining the constant function in the body. Okay, this is an example of homeostasis. One more example here he explained is kidneys maintain constant ion concentrations. See, kidneys are the major excretory organs in our body. And what are ions? So there are so many ions. For example, sodium, potassium, which are very important ions in our body. If there is a high sodium content, hypernatremia or hyponatremia, our neurological effects will get damaged. So people may get tremors. Sometimes they go into coma and all. So the sodium balance is maintained by which organ? Is kidneys. So however we take sodium, whether less quantity or a higher quantity through our food unknowingly, the functioning of the kidneys, what they are doing, they are maintaining the constant level of sodium in our body such that the homeostasis in the blood does not alter. Okay, the balance in the blood, the ionic concentration of the sodium should not either rise or become low. So this is called homeostasis. How is it maintained? This is maintained through the excretory function of the kidneys. Okay, now coming to the gastrointestinal system. So how gastrointestinal system? It provides nutrients while eliminating waste from the body. Okay, whatever we eat, we are getting energy by absorbing the nutrients from the food, and the remaining what we call as waste is excreted out through our excretory system in the process of digestion. So if our digestive system, like gastrointestinal system, does not excrete the waste from our body, what will happen? It will get accumulated in our body, it will become toxic, and ultimately eventually we will die. Okay, so this gastrointestinal system, what it is doing, it is maintaining the harmony of the body by absorbing the nutrients and by allowing the waste to be excreted out in the form of feces or urine. Okay, so this is how the system is maintaining the balance. That is what is called homeostasis. Understand? Here he has given one more example. For some of the body's constituents, this range is extremely small. That means variations in blood hydrogen ion concentration, for example, are normally less than 5 nanomoles. The blood sodium concentration is also tightly regulated. Okay, here see the sodium levels, if it is elevated, it is called hyponatremia. If it is reduced, we call it hyponatremia. And the range of the sodium level is between some 4 to 5, like that. So the range is very minute, so any deviation in this range should not be allowed in the body, which is tightly regulated by the kidneys, okay, to not to get affected with either hypo or hyponatremia. So this is how the homeostasis is maintained in our body by various organs of the body. Understand? So homeostasis is very important for the well-being, to have a normal life. Some say if any function in our any organ in our body is not in harmony, we call that is a disease. For example, if someone has got renal failure, here what we call it as an out of the homeostasis, because when there is a renal failure, kidney cannot excrete the ions, or it cannot pass out the urine, and it gets accumulated in our body, which will affect our life. So any disruption to the homeostasis, we generally call it as a disease. That disease can be either from the external source or from the internal source or from any other way, but once ever it starts affecting our body, the homeostasis will get disrupted, and it should be controlled by body self mechanism, or we need an extra support either in the form of medicine or from the surgery. Understand? Okay, to some certain extent our body will try to maintain the homeostasis even in the disease form. For example, if there is a early stage of renal failure, what happens is the body will try to eliminate the excess amount of sodium through the urine by increasing the blood pressure. Understand? So by increasing blood pressure, the filtration will increase in the kidney, and it will try to excess the amount of sodium from the body. But on the whole, increase in hypertension will leads to atherosclerosis of blood vessels, which will again affect our body, and also it will affect the minute capillaries and nephron of the kidney, and eventually kidney will get damaged, and it leads to acute or chronic renal failure. Okay, but to certain level, the body can try to compensate the disease by its own homeostasis mechanism without external support. But once it becomes chronic, it needs an external support either in the form of medicine or surgery. Okay, thank you for listening this concept homeostasis.